Okay, hello Professor, this is Nathan. I'm going to be doing the head to toe assessment. This is my girlfriend, she's going to be my patient today. So I'm going to go ahead and start the assessment now. Alright, so first thing I'm going to do, I'm going to knock. Hello, may I come in?
Yes.
Okay, hello, my name is Nathan. I'm going to be your nurse for today. Today I'm going to be doing a head to toe assessment. Do I have your permission to do that?
Yes.
Okay, so this test is going to involve a lot of touching with the stethoscope, with my hands, just doing different procedures to test certain things on your body. Is that okay?
Yes.
Okay, perfect. I want to let you know that you're in a private room and this assessment is confidential, okay? Perfect. So now I'm going to wash my hands and put my gloves on. See, washing my hands, putting my gloves on. Okay, now we're going to begin the assessment. So I'm going to start off with your head first. So I'm going to palpate your head and your scalp, okay? So let's see, good. There's no masses, no bumps. Do you have any pain when I'm doing this?
No.
Okay, good. Perfect. Alright, now I'm going to palpate your temporal arteries. Okay, good. Now I'm going to palpate your temporal mandibular joint. Do you have any pain when I'm doing this?
No.
Okay, perfect. Alright. Now I'm going to ask you to do a few things. I'm going to be checking your cranial nerves. So can you do me a favor and bite down? Okay, good. Bite down tight. Good. Alright. Good. Okay, so that shows normal functioning of the trigeminal nerve, cranial nerve number 5. Alright. Now I'm going to do cranial nerve number 7. Can you smile for me? Okay. Can you close your eyes tightly? Good. Can you raise your eyebrows? Up and down? Good. Alright, can you frown? Okay, good. Alright, now can you puff out your cheeks? Good. Now I'm going to squeeze the air out. Alright, perfect. So this shows normal functioning of cranial nerve number 7, the facial nerve. Alright, now we're going to move to the ear. So I'm going to palpate your ear, and you tell me if you have any pain. Okay? Palpating the tragus. Do you have any pain?
No.
Okay, how about this side?
No.
Okay, the patient does not have any bleeding, any drainage, any obvious redness or swelling in her ears. So that is a good sign. Here. Alright, so now we are going to do the whisper test. So the whisper test is I'm going to whisper into this ear first, and you're going to cover up this ear, and I want you to tell me what I say, and then we're going to do the other side, okay? Alright, so I'm going to come over here, cover up your right ear, okay?
4P6.
Okay, good. Now I'm going to do the other ear, cover up that one.
2WY.
Excellent. Okay, she passed the whisper test. So that means that she has normal functioning of cranial nerve number 8, the vestibulocochlear nerve. And as you can see, we've been having a normal conversation. She's able to hear it. Another indication that the test is going well. So now we're going to move to the nose. So as I look at her nose, I see that it's symmetrical. I don't see any redness. I don't see any swelling. I don't see any discharge coming out of it. Now I'm going to ask you to occlude one nostril and breathe out the other. Can you do that? Okay, good. Now do the other one. Okay. So the right nostril is a little occluded. She's getting over a sinus infection. So I'll document that in her notes, and I'll let the physician know. Maybe it's something we can look into, but it's just a little bit of congestion, nothing to worry about. Alright, perfect. So now we're going to move to the mouth. So I'm going to look at her lips. Her lips look healthy. There's no redness, no cracks, no bleeding. Open your mouth for me. Show me your teeth like that. Good. Alright, her gums look healthy. There's no bleeding. The teeth look well. Open your mouth. Stick out your tongue. Okay, the tongue looks healthy. I'm going to depress her tongue down with my tongue depressor. Okay, good. So I can see her posterior pharyngeal wall. There's no swelling of the tonsils. There's no redness, no exudate. So these are all normal findings. Okay, so now I am going to do some cranial nerves. So let's start off with cranial nerve number 9, the glossopharyngeal nerve. So I'm going to take my tongue depressor. I'm going to touch her posterior pharyngeal wall. And I'm going to elicit a gag reflex, okay? I'm only going to do it for a second. Can you open your mouth? Okay, so I did that. So the patient has a gag reflex. That's a normal finding of the cranial nerve number 9, the glossopharyngeal nerve. Now I'm going to move to the cranial nerve number 10, the vagus nerve. So what I want you to do is, can you open your mouth? Open your mouth. Say ah. Open your mouth a little wider. Okay, perfect. So I see her uvula rise, her soft palate rises, and her tonsillar pillars come together, which is a normal finding for the vagus nerve. Do you have any pain, by the way, doing any of this?
No.
Okay, perfect. So now we're going to move to cranial nerve number 12, the hypoglossal nerve. Can you stick out your tongue for me? Okay, the tongue protrudes medially and with good strength. That's a good finding. Can you wiggle it side to side? Okay, close your mouth. Can you say light, tight, and dynamite?
Light, tight, and dynamite.
Okay, perfect. So the patient is showing smooth speech. She is able to control her tongue. There's no signs of atrophy, no redness or swelling. So these are all normal findings for cranial nerve number 12, the hypoglossal nerve. Alright, so now we're going to move on to the neck portion of the exam. And what I'm going to do is, we're going to look at your carotid and your tonsils. So first thing we're going to, and also your thyroid. So the first thing I'm going to do is your thyroid. So I'm going to palpate it. I'm going to palpate your thyroid. I'm going to look for the gland. Just let me know if you have any pain when I'm doing it, okay? Alright. Good. Okay. Good. Do you have any pain when I'm doing this?
No.
Okay. Can you swallow? Okay, good. Alright, so the patient is able to swallow. There's no enlargement of the thyroid gland. I was not able to palpate it. And these are all normal findings. So now I'm going to move to her lymph nodes. So I'm going to palpate your lymph nodes, okay? So you have the preauricular, the posterior auricular, then you have the... Is everything okay?
I don't know why I can't stop laughing. Sorry.
Okay. So you have the cerebellar, and then you have the tonsillar, the submandibular, the submental, then you have your posterior cervical, you have your anterior cervical, and then you have your supraclavicular. So as I palpate these areas on her body, there is no enlargement. And did you have any pain as I palpated those? Okay, good. Let me just do this side. I'm sorry, the occipital lymph nodes. Posterior cervical, anterior cervical, supraclavicular. Okay, so tonsillar, submandibular, submental. Perfect. Okay, so now I am going to palpate and auscultate her carotid arteries. Alright, so let's do that. So I'm going to palpate first. I'm going to do one at a time. So let me just get in right here. Okay, let me do the other side. Okay, so when I was doing that, I was checking for rhythm and rate. Rhythm and rate are normal, and the intensity is normal. So she has an intensity of +2. When I was palpating, I didn't feel any thrills. which would be an abnormal finding. Okay, so also I was taking her pulse. She has a pulse of 75 beats per minute, which is also normal. I was able to look at her chest wall rise when I was taking her pulse, and she has a respiration rate of 12, which is also normal. Okay, now I'm going to auscultate your carotids one at a time. So my stethoscope has already been wiped down, and I'm wearing it correctly. So let me just come right here. Okay, good. Okay, perfect. So as I was auscultating her carotids, I didn't hear any bruits, which would be an abnormal sound in her carotid arteries. Okay, now I'm going to move to her heart. So what am I going to do right now? I am going to move along your chest for the five precordial points. I'm going to be listening to sounds. I'm going to be listening to the S1 and the S2. I'm going to be listening to abnormal sounds, and I'm going to use the diaphragm, and I'm going to use the bell of my stethoscope to check for all this. And also the S1 and S2 sounds as well. Okay, so when I come to like areas of your breast, just move the breast tissue to the side a little bit, okay? Okay. So we're gonna start with the aortic area, the pulmonic, Erb's point. Can you move your breast tissue to the side?
Sorry.
Okay. The tricuspid. Okay. Can you move it to the side again? Okay, and that's the mitral. Okay, so I heard normal heart sounds. There was no S3 or S4s detected. She had good rate and rhythm. As I was at the mitral valve, that's the point of maximal impulse, and there was no abnormal sound. So now I'm going to use the bell, and I'm going to be checking for murmurs. So I'm going to go along the same points once again. Okay, this is the aortic, pulmonic, Erb's point. Can you move your breast tissue to the side, please? Tricuspid, to the side again. And the mitral. Okay, thank you. Okay, so once again, there was no murmurs noted using the bell side of the stethoscope. Also, when I was listening to her heart sounds, you have the S1 and the S2 is what I heard. The S1 is the closure of the atrioventricular valves, which is the lub sound, and then the S2, which is the dub sound, is the closure of the semilunar valves. The S1 is systole and the S2 is diastole. So those are normal sounds, normal findings. Okay, so now what I'm gonna do is I'm gonna palpate her radial artery, her dorsalis pedis, and her posterior tibial. I'm gonna be checking rate and rhythm and intensity of the pulses. Okay, so let me start with your radial. Okay, good. Hold your arm here. Okay, so the patient has normal rate and rhythm in her radial artery, good intensity of +2. I was taking her pulse, and it's a beat per minute of 75. All right, now I'm going to come down to her uh, dorsalis pedis pulse. Good, good. Okay, so once again, regular rate and rhythm, good intensity, and now I'm going to do her posterior tibial. Okay, do the other side. Okay, perfect. All right. So first of all, I just want to start kind of go back a little bit because I missed something. I kind of missed the eyes. So I'm gonna go back to the eyes now. So that's fine. So I'm gonna check your eyes. We're gonna be checking cranial nerve 3, cranial nerve 4, cranial nerve 6. I'm gonna be doing the diagnostic positions test now. So what I want you to do is I want you to look at my finger as it moves around without moving your head. Okay? Okay, here we go. Look at my finger. Excellent. Okay, so the patient was able to track my finger without moving her head, which shows normal functioning of cranial nerve 3, 4, and 6. Okay, now I'm going to test her peripheral vision by doing a confrontation test. Alright, so I'm going to ask you to close one eye. Can you cover up one eye? Now, when you see my finger enter your peripheral field, I want you to tell me and tell me how many fingers I'm holding up, okay? Just tell me when you see it enter your field of vision.
No.
Okay, good. 2?
No.
Good.
2.
Good.
2.
Good. Okay, now cover up your other eye. Okay, tell me when you see my fingers enter your peripheral field of vision.
2.
Good.
2.
Good.
2.
Good.
2.
Excellent. Okay, so the patient was able to see when my fingers entered her peripheral field of vision, and she was also able to distinguish how many fingers I was holding up. So now I'm going to test her pupillary response. So I'm going to shine this light into each eye, and what I'm looking for is pupil constriction, I want a direct and a consensual response. Alright, so is it okay if I shine this in your eye? Okay. So look at the light, please. Okay, perfect. Now I'm going to do the other eye. Excellent. Okay, so when I shine the light in the right eye, it responds directly and constricts, and when I shine it, and then I can see the consensual response in her left eye. So they both constricted. The patient has perla, pupils equal, round, reactive to light, and accommodation. Alright, so now that I got that part back that I missed, now we're going to move forward in the exam and we're going to do the abdomen. So I am going to do the abdomen from the right side. I'm going to ask her to lay down, and then I'm going to auscultate first. I'm going to auscultate the upper quadrants and lower quadrants of her abdomen. So just lie down for me. I'm going to be auscultating, like I said, each quadrant of your abdomen, and what I'm looking for is normal active bowel sounds. So here we go. Alright, we have the left upper quadrant. Okay, right upper quadrant. Right lower quadrant. And left lower quadrant. Okay. So she has normal active bowel sounds, clicks and gurgling, over 5, less than 34. She had about 10 that I heard. Okay, now I'm going to auscultate her arteries of her abdomen, the aorta, the renal, the iliac, and the femoral. Okay. I'm at the aorta. Okay, I'm at the renal arteries now. The iliacs. And the femoral. Okay, so there was no Bruits noted in the arteries. Okay, so next I am going to percuss each area of the abdomen. So just let me know when I'm percussing if there's any pain at all in any of the quadrants, okay?
Okay.
Alright, so I'm going to start up here. Good. Okay, good. Good. Do you have any pain when I was doing that?
No.
Okay, so the patient showed good tympany when I was percussing, which is a normal finding since the abdomen is mostly with gas, and there was a few dull spots, which is also normal because the abdomen does have some organs in it. So those are all normal findings. Now I'm going to move to palpation. So just let me know if when I'm palpating light and deeply, if you have any pain in any areas, okay? Okay. So just let me know if you have any pain. Any pain?
No.
Okay, good. Okay, so she doesn't report any pain superficially and when I palpated deep as well. So now I'm going to try to palpate the spleen. When I go to palpate it, I want you to take a deep breath, okay? Okay. Can you breathe? Take a deep breath, please. Breathe out. Okay, perfect. Did you have any pain when I did that?
No.
Okay, so there was no enlargement of the spleen. I was not able to palpate it, and that's a normal finding. Okay, now I'm going to do the liver. So can you take a deep breath again when I go to palpate? Take a deep breath. Okay, do you have any pain? Okay, perfect. So there was no pain, and I was not able to palpate the liver. So there's no signs of splenomegaly or hepatomegaly. These are normal findings. Now I'm going to try to palpate your abdominal aorta, okay?
Okay.
Okay. See. Okay, as I was palpating, I did not feel any thrills of your abdominal aorta. It was normal size as well, so that does not indicate any signs of AAA, abdominal aortic aneurysm. So that concludes the abdominal exam. Now let's move to the chest and lungs. Okay, can you sit back up on the edge of the bed? So the patient looks comfortable. She's able to bear her own weight. These are all good signs. And first thing I'm going to do is I'm going to percuss the costovertebral angle and see if she has any pain back there. Okay, so I'm going to percuss right back here and just tell me if you have any pain, okay? Any pain?
Nope.
Okay, I'm going to do the other side. Any pain? Okay, so when I was percussing, there was a slight dullness and a little bit of tympany. These are normal findings because I'm percussing the kidney areas, and there's a little bit of space there, in between the ribs. So that is a normal finding. Okay, so now I'm going to auscultate your lungs. So what I want you to do is, I want you to breathe out through your mouth during the auscultation, and I want you to take a deep breath at each point that I auscultate, okay?
Okay.
I'm going to auscultate 6 points along the front of your chest, and then we're going to do the same posteriorly, okay? I want to hear good breath sounds. I don't want to hear any adventitious sounds, and I want to hear vesicular sounds throughout, especially at the bottom and midpoints of the lungs. Okay, so we're going to start here at the apices. Good. Breathe through your mouth. Good. Good. Okay, now I'm going to move down. Good. Good. Okay, can you move your breast tissue to the side a little? Thank you. Good. Now the other side a little bit. Good. Excellent. Okay. Now we're going to do the same thing on the posterior side, okay?
Okay.
Alright, I'm going to come to this side though. Okay, breathe out through your mouth, in and out through your mouth. Good. Excellent. Excellent. Perfect. Okay, now we're going to move to the sides a little bit. Good. Good. Excellent. Okay, so when I was listening to her lungs at each of the spots, in between the costal vertebral spaces, in between the ribs, she shows healthy lung sounds. There's no crackles, no wheezes, no pleural friction rub, and I hear vesicular sounds throughout the lung spaces. Okay, so now we're going to move to the neurological part of the exam. Alright, so what I'm going to be doing is, first, I'm going to check the strength of your cranial nerve number 11, the accessory nerve. Can you move against the resistance of my hand? Good. Can you do the other one? Good. Move against the resistance. Perfect. Of your shoulders. Okay, the patient is able to move against the resistance of my hands, which shows normal functioning of cranial nerve number 11. Okay, now we're going to do some fine motor movements. Can you tap the palms onto your thighs? Dorsally now. Do it rapidly. Can you do that? Okay, excellent. So she shows rapid alternating movements of her hands. That shows good fine motor function. Okay, now can you go like this with your fingers? Go like this. Good, finger to thumb. Now do the other hand. Excellent. Okay, good. So the patient is showing accurate movements, and that shows fine motor function. Alright, now we're going to do the finger to nose. What I want you to do is, you're going to put my finger out, you're going to touch it, then you're going to go to your nose. Then I'm going to move, and then you touch my finger again, then back to your nose, okay? Touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, touch your nose. Okay, the patient was able to pass that part of the exam. That shows good coordination, accurate movements, good fine motor touch. Alright, now I'm going to have to ask you to lie down again, please. Alright, I want you to take your heel and move it from your knee down to your ankle, okay? Do it with the left leg first.
Left leg.
Left leg, yep. Move it down. Good, to your ankle. Excellent. Now do the other leg. Okay, perfect. So you could sit back up now. So the patient was able to pass the heel shin test, and that once again shows good coordination and good motor movement. Okay, now we're going to do the reflexes. So I'm going to use my reflex hammer, and first I'm going to check her biceps. I'm going to strike the tendon softly. I'm not going to hurt you, obviously. And I'm looking for a flexion of the biceps muscle as the reflex. Okay, so put your hand here. Here's my reflex hammer. Okay, good. Check bilaterally. Okay, so there was flexion of the bicep, and that shows the normal reflex. Now I'm going to do her patellar tendon, and I'm looking for a reflex of her quadriceps muscle, an extension of her quadriceps muscle as the reflex. Okay, here I go. I'm going to strike it. Good. Strike the other patellar tendon. Okay, perfect. That shows she's showing good reflexes, and those are normal findings. So now I'm going to use this tuning fork that I have here, and I'm going to place the tuning fork onto your big toe. I'm going to strike it. You should feel a vibration. I'm going to test your vibration sensation, okay? So tell me when you feel it start to vibrate and when it stops, okay?
Okay.
I've struck it.
Okay.
Okay, did it stop?
Yep.
Okay, perfect. So she has a good sense of vibration. So that is another normal finding. now I'm going to test the proprioception of her big toe. I want to see if she can tell me if I'm moving it up, moving it down, moving it right, or moving it left. Okay, so I want you to close your eyes. Okay, tell me if I move your big toe up or down.
Up, down, left, right.
Alright, perfect. Let's do the other side.
Down, up, left, right.
Excellent. So the patient shows good proprioception. She's able to discern whether or not I'm moving her big toe up or down. Alright, now for the final part of the exam, I am going to ask you to stand up.
Okay.
Now we're going to perform the Romberg test. So I want you to stand right here, put your feet together, arms at your sides. I'm going to ask you to close your eyes, and then you're going to tell me, you're going to close your eyes, and you're going to try to keep your balance for at least 20 to 30 seconds, okay? Alright, I'm going to be standing right here to catch you if you lose your balance or start falling, okay? Close your eyes. Okay. Okay. So she already has a precondition where she loses her balance. The physician knows about this. So this is a positive Romberg test, not a negative. And I'm going to document this, let her physician know. And this is actually a normal finding for her. It's just she can't maintain her balance. That tests the vestibulocochlear nerve, cranial nerve number 8. So now I'm going to ask you to stand over here. And what I want you to do is, careful with this little cord. I want you to not yet walk across the room in a straight line, and I'm going to be observing your gait. Okay, go ahead. Perfect, now come back. Okay, the patient has a normal gait. She's able to maintain her balance and walk in a straight line. Now we're going to do the tandem walk. Can you please do a same thing you just did, but instead this time go heel to toe. You're going to put your heel first, heel to toe, heel to toe. Can you do that for me across the room?
Yeah.
Okay, come back. Okay, excellent. So the patient was able to maintain her balance. She walked in a straight line, and her gait was normal and with good coordination. So that's it. That concludes the test. Thank you so much. Do you have any questions for me?
No.
No questions? Okay, perfect. So what I'm going to do is I'm going to take off my gloves. I'm going to wash my hands. Washing my hands. All right, perfect. The doctor will come see you soon. That concludes our head-to-toe assessment. Thank you for coming in, and have a nice day.
Thank you.
Okay, perfect. That is my exam, and thank you, Professor. I'll upload this later on.